Welcome dear students. Myself Darshana Sandeep Shinde from KK Institute of Pharmacy, Chandori, Nasik. Today our discussion topic is narcotic analgesics. Let's start our discussion. Learning outcomes of our today's discussion or lecture are: students should be able to understand the concept of, that is, he is to understand the classification of narcotic analgesic, difference of opioid and non-opioid analgesics, mechanism of opioid receptor, recognize the pharmacological action of the morphine, therapeutic uses of the morphine, and there is a comparison of morphine and ethidine. Let's start what is meant by analgesic. An analgesic or painkiller is any member of the group of the drug used to achieve the analgesia, that means relief from the pain. Analgesics are the drugs that relieve the pain due to the multiple causes. They relieve the pain from the multiple causes. Drugs that relieve the pain due to a single cause. Example of it is ergotamine, that is it is used in migraine. Glyceryl trinitrate used in angina pectoris are not classified as analgesic. That is, analgesics are the drugs that relieve the pain due to the multiple causes, not from the single one causes. Analgesics are classified into the two main groups. Major classes of the analgesic drugs includes: first one is opioid, second one is non-opioid, or it is also known as the non-steroidal analgesic in antipyretics drugs. First of all, we see what is the difference between opioid and non-opioid analgesics. Opioid analgesics are the most powerful analgesics, and non-opioid, that these are the mild analgesics as compared to the opioid one. Second one, in an opioid analgesic that can relieve the pain or any type of pain except the itching, and in non-opioid effective in a mild type of the pain as headache, toothache, etc. In opioid, mild pains can be relieved. In non-opioid, mild pains can be relieved, and in a opioid one, itching, all types of pain can be relieved except the itching. Then opioid analgesics mainly act at the level of the cortex, and non-opioid act on the level of the thalamus and the hypothalamus, where they act. Opioid analgesics can produce the addiction, and non-opioid, they do not produce any addiction. Example of the opioid analgesics are morphine, codeine, etc. And non-opioids example is all the NSAID drugs, including salicylates, paracetamol, etc. And one more thing about the non-opioids, these are used to lower the elevated body temperature. Where non-opioids are not used for this purpose, then these are not used for to reduce or to lower the elevated body temperature. Okay. Then we see what is meant by narcotic analgesics or narcotic opioids. Narcotic analgesics are the drugs that relieves the pain by binding to the opioid receptor, which are present in the central and peripheral nervous system, can cause the numbness and induce a state of unconsciousness. Narcotic analgesics may produce a numbness and a state of unconsciousness, and these are mainly act on a central and peripheral nervous system. We see the classification of the narcotic analgesic. It is mainly divided into three parts. First one is natural compounds. Example of its morphine, codeine, papaverine. Secondly, semi-synthetic derivatives, in that diacetyl morphine, which is also known as the heroin, then benzyl morphine and ethyl morphine. And third type is synthetic derivatives. In that fentanyl, pethidine, then methadone, etc. are the examples. These natural compounds are further divided into two parts. First one is phenanthrene group alkaloids. Example of its morphine, codeine, thiamine. And secondly, benzyl isopuranil group alkaloids. Example of its papaverine in nascapain. Let's start one by one. Opioid receptor. First of all, we see what is meant by opioid receptor. All opioid receptors are like or linked through the G protein to inhibit the adenine cyclase. These are also facilitate the opening of the potassium channel, causing the hyperpolarization. Because of opening of the potassium channel, there is a hyperpolarization, and inhibit the opening of the calcium channels. Calcium channels which are responsible for the transmitter release, and which if the calcium channel is inhibited, there is the inhibiting of the transmitter release. There are 4 type of the receptors, opioid receptor. First one is mu receptor, then sigma receptor, then delta receptor, and then kappa receptors. We example of the natural category, there is a morphine. We see the pharmacological action of the morphine on the central nervous system. Morphine is mainly a central depressant, but certain centers are stimulated by the morphine. In the pharmacological action is divided into the action of the morphine by its which part of the organ it act. Firstly, it act or it depresses the central nervous system, or it depresses which type of the center. Centers depressed by morphines are, first of all, cortical pain center, then respiratory center, and cup centers are depressed by morphine. Then second pharmacological action of the morphine, centers stimulated by morphine. First we see the depressed by, here the center stimulated by the morphine. Morphine is also responsible for some centers which are stimulated by it. First one is vomiting center, second is accumulator center, then third one is a stimulation of monosynaptic spinal reflexes. Then fourth is the release of antidiuretic hormones, ADH, from the posterior pituitary glands. These are stimulated by the morphines. And last one is the stimulation of cardiovagal centers, leading to the slow and full pulses. These centers are stimulated by the morphine. Then action of the morphine on the muscles, on the plain muscles. Morphine increases the tone of the smooth muscle and causes the spasm of the sphincters. First of all, we see on the gastrointestinal tract, its effect. Then spasm of the biliary passage, on which morphine gives its action. Then on bronchi or bronchi. Then urinary bladder. In urinary bladder, it causes the urinary retention. Then increase the tone of the ureter. On metabolism, action of the morphine or pharmacological action of the morphine is, morphine decreases the basal metabolic rate. Because of morphine, there is a decrease of the metabolic rate. On histamine, a morphine is a histamine releaser. Because of morphine, there is a histamine release in our body. On the skin, morphine causes, because of the release of the histamine, it causes sweating, that is wet sweat, then vasodilation, that is flush skin, then itching. Then allergic skin reaction can also occur because of the morphine, and which is on the skin, but because of the histamine release. On cardiovascular system, therapeutic dose has no effect, but high dose can cause the hypotension due to the peripheral vasodilation, because that is because of also because of the histamine release. Then inhibition of vasomotor center. Then we see the therapeutic uses of the morphine. Morphine is a very powerful analgesic in the treatment of the severe pain conditions, in a coronary thrombosis, in a renal colic, in a post-operative pains. It is also a very powerful analgesic. Then terminal stages of painful malignant disease, morphine is also useful is there. And in some pre-anesthetic medication, morphine is also used in the combination of anesthesia. Pre-anesthetic medication 10 to 15 milligram subcutaneously or intramuscularly 1 hour before general anesthesia it is given, and it is used as a pre-anesthetic medication. In paroxysmal nectaral dyspnea, to elevate the dyspnea. Certain cases of severe cough, That is a cancer of the bronchial tree. In that condition, morphine is also useful. Then certain cases of the severe diarrhea is also morphine is used as a antidiuretic or antidiarrheal. Then side effects of the morphine includes minor side effects of the morphine includes nausea, vomiting, constipation, itching, then bronchoconstriction, hypotension due to the histamine release. These three, itching, then bronchoconstriction and hypotension. These three effects are because of the release of the histamine. Then urine retention is also a minor side effect. Then increase intracranial tension. This one is the also a minor side effect of the morphine. Then in the category of the major side effect, respiratory depression. This one is the major side effect of the morphine, and addiction. These are the two major side effects of the morphine. Then contraindication, what are the in which condition morphine should be preferred to contraindicate? In bronchial asthma, in a chronic pulmonary diseases, case of the idiosyncrasy to morphine. Then advanced liver diseases, morphine is contraindicated. In a certain head injuries, that is a respiratory depressions, increased carbon dioxide level which cause the cerebral vasodilation and so elevated cerebrospinal fluid pressure. Then during the delivery, morphine is not preferred as an analgesic because morphine crossed the placenta, leading to the respiratory center depression and neonatal asphyxia. Then biliary colic conditions increase the biliary pressure, that's why it is contraindicated. Then actual abdomen pain, in an actual or acute abdominal pain, morphine is contraindicated because it relieves the pain but interfere with the diagnosis of the condition. Then myxedema, low basal metabolic rate, because of its metabolic rate is get decreased. In a prostate hypertrophy, in a hypotension, in all that condition morphine should be contraindicated. Then constipation also, because of the low metabolic rate, or it decreases the metabolic rate, that's why morphine is contraindicated. Then second drug under the category, that is codeine. It is a less potent, it produces constipation also, nausea and vomiting are less, it is a less addiction. Use of it as a cough depressant for a dry cough, as an analgesic with the aspirin and paracetamol. Then semi-synthetic derivative of opium are heroin and dimorphine hydrochloride. It's also known as a dimorphine hydrochloride. Dimorphine is a semi-synthetic derivative of the morphine in which both hydroxyl groups have been acetylated. It causes the similar analgesia and respiratory depression as a morphine, but less nausea, vomiting, constipation and sedation. Dimorphine is very prone to cause the dependent. That's why its use is illegal in many countries. Synthetic morphine derivatives are pethidine or mepridine. In that atropine-like action, it has a morphine-like action, papaverine-like action, that is its action on the smooth muscle. There are some points of pethidine which are differ from the morphine are, its analgesic action is 1/10 of that of the morphine. It does not depress the cough. It does not depress the respiration in the therapeutic dose. Then it does not cause the constipation. Morphine causes the constipation. Has an atropine-like action. Pupil is dilated. And tolerance and addictions are less than that of the morphine. These are the which differentiate the pethidine from the morphine. Let's understand very clearly. Its dose is 50 to 100 milligram orally or parenterally, subcutaneously or intramuscularly. Let's discuss the therapeutic uses of the pethidine. Analgesic instead of the morphine. In an obstetric to relieve the labor pain. As a pre-anesthetic medication instead of the morphine. Better than the morphine. These are the differentiable points which differ the morphine from the pethidine. Thank you very much.